in a short while, we have listened to all the presentations, and what resonates with me is the fortitude and resilience of oncology nurses, which has led to the many successes in oncology. In all our efforts, even in serene circumstances, we are faced with burnout and emotional stress. And like we've listened before, it is worse in low and middle-income countries with limited knowledge, less access to training of colleagues or all the disciplines in oncology, especially oncology nursing specialization, which cause late presentation with all the stress that it brings to the staff in oncology care, especially nurses who are there 24/7. And to make it really worse, we listened to our friends from Palestine and the situation of humanitarian crisis and how it is dangerous and difficult for nurses to function, even with the willingness that they have. What more can we do, to encourage ourselves, besides the self-care that we personally do, than to hear from someone who has benefited from the services of oncology nursing care and the whole multidisciplinary team. So we'll take this time to listen to Prince Nyamadi. He's a co-founder of Living Dreams Foundation, and he was the president from inception to 2020. He's a doctor of medical laboratory sciences with a bachelor's in biomedical lab science. He had cancer as a child. And in this foundation, he believes in servant leadership. During the Gold September, he collaborates with Kolebu Teaching Hospital in Ghana, in West Africa, and the National Blood Service in Ghana. He holds partnership with World Child Cancer, Lifeline for Childhood Cancers, and Childhood Cancer International. Let us get inspired with this survival of our services. Over to you, Prince Nyamadi.
Thank you so much. All right. Thank you so much. It's really an honor to be here as a survivor, and I want to thank everybody for participating. Can I share my slide, please?
You can, yeah.
Okay. All right. Thank you once again. My name is Prince Nyamadi. I'm a childhood cancer survivor and from Ghana. I'll be talking about giving back as a childhood cancer survivor. We'll be looking at a brief introduction about myself, my survivorship story from when I was being diagnosed of cancer, and then through the journey up to when I became a survivor, and then my impact as a survivor. Okay, so as I said earlier, I'm a childhood cancer survivor. I was diagnosed with acute lymphoblastic leukemia in the year 2002. And I started my treatment in 2004. I abandoned treatment, and so I had a relapse and had to go back and start the treatment all over again. But God being so good, in 2009, I was declared a survivor of acute lymphoblastic leukemia. And that birthed a foundation called Living Dreams Foundation, because there were some basic things that as a cancer patient then I was expectant of, but looking at the situation then, I couldn't see them, or it was something that I didn't experience as a cancer patient. So I thought it wise that I could form a foundation and then be able to impact whoever, unfortunately, is being diagnosed of cancer, and then the community as a whole. I'm a biomedical scientist by profession. I have BSc in biomedical sciences and doctor in medical laboratory science. Okay, so in Ghana each year, we expect to receive 1,300 new cases. And as I said, I was diagnosed with acute lymphoblastic leukemia. So during my treatment as a cancer patient, there were some adverse side effects that I would like to talk about. This will just contribute to my presentation and make it more understandable as to what I want to really discuss. So during treatment, I had my hair loss, alopecia, vomiting, fatigue, loss of appetite, weight loss, and so on and so forth. And after treatment, obviously, one thing about cancer treatment is that the journey really starts after you are even being declared a survivor. So obviously, anxiety, fear of reoccurrence of the disease, PTSD, post-traumatic stress disorder, flashbacks of the experience I went through, hormonal changes, depression, mood changes, and concentration issues. But I would like to dwell more on the during treatment because this, contributed to what we call stigma because there was little awareness of childhood cancer back then. Okay, so as I said earlier on, based on this adverse side effects as a cancer patient, there were three important challenges that I faced, or the hospital in which I was being treated, I realized. And one was there was little awareness about childhood cancer in Ghana then. The treatment cost of cancer were not covered by our national health insurance scheme. And so it was as pay as you go. It wasn't free. The treatment wasn't free. And then I wanted other children affected by cancer to also have the same opportunity that I had then. And so that birthed the foundation, Living Dreams Foundation. So as I said, first of all, what I did to eradicate the little awareness or no awareness about little awareness about childhood cancer was to start with public awareness creation and then education. So advocating for change. So this is a picture of myself and then Megan in 2017, where we started, with this public awareness creation and education. Let me add that Living Dreams was formed in 2014. However, I was still in the university, so we started with the awareness creation back in school. And after I completed university in 2017, that was when everything was being, taken out of the school, and then we went into the public, proper. So this is a picture of myself and then Megan talking to some service users of a shopping center in Accra. And as I said, because I wanted to create awareness, I thought it wise that we should also, channel that same information to schools, to high school, junior and senior high schools in Ghana. So we try as much as possible to went to different, schools in different regions in Ghana to just educate the children about childhood cancers, tell them some side effects of it, tell them some ways, to just let them know about childhood cancer, let them know um, um, some signs and symptoms in case, they see on themselves, and then report to the teachers, and also share some materials to the teachers as well. This is another picture of me in the Volta region with some colleagues of mine, in Living Dreams Foundation doing the senior and junior high school tour. We didn't stop there. We again, started with what I said earlier, just to propagate the awareness creation, and then we veer into media engagement where I went there, telling people about my story, and then speaking, on issues that I think I face as a cancer patient. So this is a picture of myself and then my co-founder of Living Dreams Foundation. And then there's the second picture on my right. That's myself and then a doctor of Kolebu Teaching Hospital, and as well as a founder of another foundation, when they, to talk about childhood cancer. There's another picture of myself and then my co-founder in a radio station in Ghana, still propagating and then creating awareness, educating the public about childhood cancer. The third thing I would like to talk about is we started programs and then support groups. Because I realized that during my cancer treatment, there was one major thing that even as a family and as a hospital, we were facing. That was blood transfusion. And so, during the treatment uh, during the chemotherapy or as a childhood cancer survivor, there were times which, my blood was very low. And so it was important for me to be transfused. However, because there was sometimes there was a shortage of blood. It was difficult for me to, get a pint of blood, to be transfused. So we came up with a program and then started what we call the blood donation exercise drive, where we go to secondary schools, speak to the authorities. They give us the go ahead, they give us that green light. And then we speak to the students, whoever that wants to support these kids. Um, we take a professional or professionals, to these places. They do this blood donations stuff. We take their blood, we take this blood back to the hospital, process it, and then we hand it over to the oncology ward so that in case any child needs a blood transfusion, to be easier for them to get access to this blood rather than going to the hospital blood bank to fight for even a pint. Even with the kids, they don't even need a pint of blood. They just need half of this pint of blood, to help them in their chemotherapies and then to help them, boost their blood levels. This is a picture of some of my friends and a brother of mine who donated his blood, to support these kids. Again, the fourth thing I would like to talk about is supporting parents, families, and then caregivers. So it didn't stop there. As I said, there were some challenges I faced. So one thing I realized was that the people visiting the wards were not forthcoming. I didn't know why. Maybe because they didn't know then kids could, get cancer, or kids could be diagnosed with cancer. So we didn't have that support groups and then that foundation coming in to support us. So I took it upon myself and then spoke to some friends and families. We came together, and what we do is every quarter in the year, so that is, we have 4 quarters in the year, we visit the ward, we buy some relief items, we buy some items that the ward needs, we go there and then donate it to the ward, to support these kids in their treatment, and then support the nurses and then doctors on the ward, to give a better and quality treatment to the patients. Again, I serve as a peer counselor where, because I have gone through the treatment and then I'm a survivor now, it doesn't stop there. As I said, it's the beginning of the whole journey. So I go back to the ward, speak to these kids and children, letting them know that indeed it is possible for you to also survive, cancer. And so therefore, what you need to do is to just go through the treatment. You don't need to abandon the treatment. Even though sometimes it's difficult, to be very honest, looking at the pain of the injections, looking at the treatment, even at some point in time, I had to stop school because I wasn't feeling too well for a whole term, even up to a year. I wasn't in school. So I'm there as a peer counselor to just encourage the kids, to know that indeed I have gone through it, and so they could also be like me. And I also serve as some form of motivation to the parents as well, because if they know that I was just like their children or their child, and I've gone through the treatment. I've been able to go back to school, to university, and then become who I am today. Then it's possible for their kids as well to also go through this treatment and become like me. So this is what I do as well. And then as I said earlier on, that because childhood cancer then wasn't on our national health insurance scheme, and so it was pay as you go. It wasn't free. It was very expensive, to treat. So I was part of a delegation that submitted a petition to our parliament, the Parliamentary Health Select Committee, to just, appeal to them to consider 4 childhood cancers on our national health insurance scheme. And so I was part of a delegation. This is just pictures of myself and some parents of these kids as well. And then we went in there to present our petition to Parliament. And fortunately for us, in 2002, the government, considered our petition, our plea, and then they considered this for childhood cancer on our national health insurance scheme. Again, I would like to talk about fundraise for relevant programs and research. That is scholarship program. Because I'm a survivor, one thing I realized was that, because then my parents, spent a lot of money on my treatment. So there were some form of deficiency when it comes to my family, because more money was pumped into treatment. There was some form of lack of financial support in terms of education. So when I became a survivor, I spoke to World Child Cancer about this, and then we came up with idea to raise fund, to support any child that survives cancer, to support their education or vocation in which probably they want to veer into. So we came up with what we call the Rory Macmillan Scholarship Program in 2002 to support survivors of childhood cancer, cost associated with continuing junior, senior, tertiary, or vocational education. So whoever child that survive cancer, we let you know that there is this program that would support your education or vocation if only you are interested. So this is one of our beneficiaries, Charles Tete. He learned a vocation, and so this is like his graduation, holding a certificate, after learning his vocation. He was diagnosed with acute lymphoblastic leukemia as well, and then survived in the year 2011. There's another beneficiary, Grace Adole, who is also a survivor of retinoblastoma, and she went to senior high school, so the scholarship, sponsored her through her education until she completed senior high school, and now she's preparing to go into her tertiary education. This is another beneficiary, Samuel Ofori, who also benefited from the scholarship fund, and he suffered from Beckett's cancer, also completed his senior high school, preparing to go into further education in tertiary education as well. And lastly, I'm the last beneficiary. I also was sponsored to do my Doctor of Medical Laboratory Science. So I'm also a beneficiary of the scholarship fund. In this year, in September, during the Childhood Cancer Awareness Month in September, my foundation, carried out a research project where we wanted to find out more about these survivors, how they were feeling, how life has been, even after treatment and all that. So this is just a summary of the outcome of the project that we carried out, and our sample size was 10 survivors, because we had wanted to start from somewhere, and then gradually we can open our arms and then include more survivors in this project. So the first picture you see on my left is we asked the survivors the year that they were diagnosed and then the year that they were declared survivor. So looking at the bar chart on my left, you could see that most of the patients that were diagnosed of cancer, some within a year, others within 2 years, they were declared survivors, meaning that Ghana is gradually becoming um, um, a world-class, especially the hospitals becoming a world-class hospitals to be able to treat, diagnose and then treat cancers. But unfortunately for me, because I abandoned treatment, it took 7 years for me to treat acute lymphoblastic leukemia. But normally, it shouldn't take, as a male, it shouldn't take you more than 3.5 years to treat acute lymphoblastic leukemia in Ghana. And then on my right is the pie chart. We asked them of their reaction as a survivor when they were diagnosed of cancer. And 50% said they were sad. We had 20% saying they were angry, 20% saying they were confused, and then 10% saying they were moody. We asked, we further asked them, those that were sad, why they were sad. They said, they were going to miss schools, miss their school, miss their friends. They wouldn't be able to participate in some activities in their communities any longer. But and then because of stigmatization, because if you are going through chemotherapy, obviously there were going to be there were going to be some changes in your and physical appearance, like you losing your hair, weight loss and all that. So that was why they said, sad. Some said they were angry because it wasn't something they were expecting, as a child. Some said they were confused because they didn't even know what cancer was. And even as a child getting cancer, they just were confused about the whole thing. And obviously moody, we were all moody about obviously every child will be moody, being diagnosed of cancer and telling you that you are going through treatment for 1 year or 2.5 years or 3 years. Obviously you're going to be moody about your diagnosis. Again, we asked some survivors, did you know that a child could have cancer prior to your diagnosis? We had 6 responding no, and we had 4 saying yes, meaning that the awareness creation that we've started has really, yielded positively because through our awareness creation, they said yes, obviously. They heard me. Some said they saw me on TV, heard me on radio. Some said they remember me coming to their schools, to talk about childhood cancer. So we had four participants say yes, they knew about the diseases, they knew about cancer before they were diagnosed. And then on my right, the pie chart, also we asked, source of information. And as I said earlier, some said on social media, some said, health workers, and then in schools. As I said earlier, we went to schools on social media. We did, radio, we did TV, we did Facebook, Instagram, sharing, posting, and all that. Sorry. So again, we asked survivors. This is just a summary, as I said earlier. We asked, did anyone prepare you psychologically and emotionally after your treatment? Because as I said, the post-traumatic stress disorder of being a cancer of being a cancer survivor is something that I would like, professionals to take a critical look at. It's very important to go through the treatment as a patient and then survive. However, after you have survived, is there any form of institution? Is there any form of method? Is there any form of organization that is responsible to ensure that we we are emotionally stable, we are psychologically stable, we are physically strong, because trust you me, most of us are just left with our fate, whether life goes on or not. And we go into the communities and then start struggling with somebody who has had his whole life, not struggling with cancer to fight for the same job, fight in schools. And even sometimes if you tell them that, you are a cancer survivor, and so probably if they could consider, especially at job and all that, they think you are lying because it doesn't show on you that you were once diagnosed of cancer. So we asked them if anybody prepared them psychologically, emotionally after treatment. We had 7 saying no, and we had 3 saying yes. So the no means there has to be we really have a lot of work to be done after somebody being declared declared survivor of cancer. And then on my right, we asked survivor, do you think that you have a bright future as a survivor? And obviously, we had 100% positive response, meaning that as a survivor, we all know that indeed, you alone, you surviving cancer alone, it's a great achievement. And so there is nothing on this earth that you cannot, fight and you cannot achieve as a survivor. All right, thank you so much. And yeah.
Thank you very much, Prince Nyamadi. Having experienced childhood cancer, you are the best person to testify. Like you say, the journey begins after you are declared a survivor. On behalf of nurses, the healthcare team, for ignorance, forgive us because we are growing. It's only this honesty that helps us to improve our services. We cannot thank you enough. If there was a better word than giving back, I think that is what we will call what you have done. But that's just the word that is there. And we take this opportunity to thank you so much for what you have done, especially coming from a low and middle income country, coming from sub-Saharan Africa. You are really inspiring. The work you do, the work you have done, what you have ahead of you is tremendous. We salute your courage. Amidst all the words we have heard today, all the lessons we have learned, I think it really encourages us that somebody can switch in and out of therapy and you survive, and you are such an instrument in cancer care. Thank you so much. We continue to look up to you. I think your story will not only encourage Ghanaian survivors, it's going to encourage survivors in other countries, because on this platform, we will carry the stories to our various countries, and it can serve a great deal, in moving the cancer care forward. Thank you for highlighting your challenges to us. They have really been noted. And as a group of nurses, we will work on it and we'll take it to our other colleagues. Now we move